October 6th, 2020 Oshkosh Committee on Aging meeting. And we have some people here presently, and most are out in the virtual world this morning. And like to cover a couple of things regarding those who are remote that need to mute and unmute yourselves in a timely fashion. Stay muted when not speaking. If you have a question, raise your hand, and I think Ray's going to have a comment about that as well.
Yeah, just a couple general comments, and this is going forward for all meetings. If you're attending here in person with the masks, it's hard for the individuals on virtual meeting to hear you, so I'd encourage you to be as close to the mic and speak as loudly as you can, and hopefully you're hearing us okay that way. As far as raising your hand, obviously there's the typical way to raise your hand, but if you're in WebEx, if you go to the right side of the screen, or if you pull up the participants list, or you see your name, you should be able to hover over and just see a hand that appears, and if you click on that hand, that's you raising your hand virtually. Is everybody able to see that? Okay. Judy, are you good? Judy Ritchie? Okay. So let's do that. Sue Ashton, I see that you don't have video. So if at any time you have that you want to give input, I think you're just going to have to unmute yourself and just ask for a moment, or just say you have a question or a comment, I think, at this point. We do have a staff member, Ann Schaefer, who will be here at all your future meetings. She's going to be your tech IT person. And as you raise your hand to give some input, Ann will be watching for those, and then she will notify the chair in some manner that one of you virtually has a question or a comment. Okay? Thank you.
Okay, we'll move on. Just want to make note of the fact that I'm the vice chair, Ron Durkup, and I'll be chairing our meeting this morning. Move to the roll call, and Bobby, if you'd please do that.
Sue Ashton.
Here.
Heidi Bassford Kirkhoff.
Here.
Julie Kiefer.
Here.
Julie Davids.
Here.
Ron Durkop.
Here.
Julie Maslowski.
Here.
Judy Ritchie. She's here. Deb Allison Osby. Here. Lindsay Christensen. Here. Jean Wallerman.
Here.
Okay, thank you. The next item is the approval of our September 1st, 2020 minutes. All have had a chance to see those. They were distributed earlier. And are there any additions or corrections? Okay, hearing none. Is there a motion to approve?
Motion to approve.
Second?
Second.
Okay, it's been
Julie Maslowski.
moved and seconded, the approval of the minutes as distributed. Moving on to new business. We're excited this morning to have Stephanie Gildenvan from the Winnebago County Health Department with us, talking about a very, very critical subject that we're dealing with, especially during this COVID pandemic, and she'll be talking about isolation and loneliness. Stephanie, go ahead, please.
Hi, thanks for having me. I think I need the clicker when it's ready, but I'll just introduce myself while we're getting the PowerPoint up. I'm Stephanie Gildenvan. I work at Winnebago County Health Department. I've been there for just over 5 years, or almost 5 years, and part of my work is focused on substance use, the overdose fatality review, that kind of work. And that has also led to some of our work around social connectedness and discovering some of the data that we have from our own community on social connectedness and social support for both adults and youth. And what I'm going to share to you today is some of the overview for adults and social support, where we're getting some of the information from, as well as what it means for older adults. And I'll put some caveats in that too, because it's really coming from a survey. And from what we hear, some people's experience with the results is different than the results that we have. So, yeah, you changed the date. So I was supposed to present in August, and the printout you may have says August on it. I don't know if this works. I think I might need you to forward the slides. Thank you. So I just wanted to start with a general definition of when we talk about social connectedness and social support. There's other words like isolation and loneliness that comes into hand, but we're really talking about 3 key pieces: having strong relationships, feeling a sense of being valued, like you are a valued person in our community for who and what you are, and also the ability to contribute in a way that you find meaningful to your community. Those 3 things. And your community could be your family, it could be your neighborhood, it could be your workplace, your school. So those 3 things are the core pieces of what we're looking at when we're trying to figure out how do we help foster and build social support and social connectedness. So there's an adult health survey that is conducted every 3 years. It's a tri-county survey. There's 500 surveyed adults. The results for this survey that I'm going to share to you are for Winnebago County only. And it's all weighted based on demographics of our community to reflect the demographics of our community. There's one question in that adult health survey that weighs a lot of things, from mental health to alcohol consumption to activity, fruits and vegetables. And the one question that we really looked at for the adult health survey related to social connectedness is how often do you get the social and emotional support that you need when you need it? And so I'm going to show you some cross-tab results of who answered this question for I get the support I need or I don't get the support I need, and what that looks like for demographics in our community. So 1 in 5 adults in Winnebago County say that they do not get the social and emotional support that they need. And it actually goes, so youth have similar questions, and the youth in our community have a little bit more support from the survey results that they share, and it gets a little bit worse in our county as you become an adult. Click the next one.
Sorry.
That's okay.
I know.
So this next slide here is for like some demographic data based on some disparities that we identified. So the age category that we see, so 22% are not getting the support overall for adults in our community. It gets a little bit worse for the age demographic 35 to 44. Households with only 1 adult in that household also continue to increase in the area of not getting the social and emotional support that they need. And then when you have 2 or more children in the household that are under the age of 18, that social support really seems to kind of become a major factor. And what we see is wherever there's major life changes in a person's, like transitions in a person's life, we see social support start to be challenged. And some of that's natural. People that are 18 moving from their home into a world outside of school, people having children and having a newborn, people retiring. There's major transitions in your social structure, moving and things of that nature. So you kind of expect a certain amount of change when it comes to social support. And it's the ability to, for our community and the individuals in our community to regain that support that we're really looking at. Thank you. So here is the age demographics overall. So we see that the 35 to 44-year-olds are those that have identified themselves as not having the support that they need. The age category that we're looking at here today, the 65 and older, seems to have the most support of all age demographics. There's some good things to say there. I will also say this depends on who responds to the survey, who is able to answer a phone call to take the survey. And from some of the initial conversations that we had when we did interviews is also the ability to really be open and honest when maybe some of that lack of social support could result in you going into assisted living or other changes. So The caveat that I mentioned earlier is we would really love to know more information about this, which requires probably doing focus groups in the future to really understand some of those changes. And 65 years old and older is a pretty big age demographic. So are there differences in there? So this survey and the results that you'll see kind of pose more questions than they necessarily offer answers, but they help us direct those questions to help us understand what really is the issue around isolation, loneliness, and lack of social connectedness for older adults. So here you see those that only have one adult in the house. This is for any age demographic for adults. So it could include 18-year-old, it could include a 65, 70-year-old. But the fact of having one adult in the household really does seem to make a big difference for the lack of social support. Income did not necessarily play into this. So people with very low incomes and people with very high incomes equally did not have the social support that they needed. People with more middle incomes seem to have more support than lower and higher incomes. So another factor that really does come into play is mental and physical health. When your mental and physical health stops you from being able to do the normal activities, 34% of those said that they are not getting the support that they need. So when you start layering some of these factors, maybe you're an adult that lives alone, maybe you also have some mental or physical challenges, we start to see a compounding area of not having the social support that you need. 42% of those that did not have the support that they need said that they considered suicide in the past year.
Stephanie, just a question there. Would that be them implying that 58%, on the other hand, who also considered suicide, did have the support that they were?
I wouldn't quite do the math like
You wouldn't
that,
do it?
because
Okay.
some choose to not answer all of the questions, and so
Okay.
not all the numbers are going to add up to 100.
I see, okay.
But there's certainly a difference between are people accessing the resources and services versus having support. And some of that stuff can get tied together because access to services sometimes also makes a person feel supported.
Right, okay.
Okay, the next slide. So we did some analysis specifically on older adults because of the amount of work that we do as a health department with the older adult population. And you see here, really older adults that answered the survey fared better than the average. So wherever there's parentheses at the end, that's the average for all adults, and the number before that is for older adults. So older adults that report having poor health, 16% of them said that they do not get the support that they need. Physical and mental health prevented them from having their usual activities. 13% said that they do not get the support that they need. And then older adults living alone, 10% compared to all adults, 23% said that they do not have the support that they need. So this doesn't necessarily ring true from a lot of the people that we work with that serve older adults. And if that's the case, then this is where we have to go and have more conversations to really understand what's going on in our community and how different is that 65-year-old compared to maybe a 75 or 80-year-old as far as that social support.
Stephanie, one other question here. The remaining percentages here too, would that be the same? Some people are not responding to the surveys?
Yes.
Okay.
And some may have not responded to the question on older adults.
Okay, sure, okay, all right, thank you.
So now I want to talk about like what do we see that helps build and foster support. So I just want to say there's a lot more conversation that we need to have. We need to better understand this and what it means for our community. Our families moving away and older adults are, left here alone. What really is the circumstances and conditions that are happening in our community? That helps us better understand what are the opportunities that we have to make changes. We do see this issue around social support and social connectedness as not being just behavior change of like, I need to go get more friends, and so I will go get more friends. But it's also how we interact and who we are as a community that allows people to even be able to access people so that they can actually get to know. So one piece that we really highlight is having more opportunities to connect where you can spend some time. So remember, we talked about social connectedness being a strength of relationship, a sense of feeling valued, and also giving back. So opportunities to connect to your faith community, to volunteering, your workplace, walking kids to school, that kind of a thing really does help build and foster some of that social support. And not everyone has access to things like transportation or ability to have mobility. So what does that mean, especially as you become an older adult, or on the flip side, are a young child? So how do we start to foster some of that instead of saying, yeah, just show up on the other side of town at 6 o'clock at night and then you can start your volunteering? We need to look at different ways for people to have some of that access to volunteering and that meaningful contribution. The other piece is all of the strategies that we can look at to help foster and build these relationships. Neighborhoods is a great one. Like, everyone lives somewhere. So if we're having people that are so disconnected, maybe because they can't leave their home, they still live somewhere. So having neighbors look out for neighbors, all of these strategies need to be interconnected. There's not one solution that's going to solve our challenges around social support and social connectedness in our community. The other piece is to start local and organically. So a top-down approach isn't going to build and foster these relationships or help people connect in their communities and find value and give back. So looking at ways that we can, whether it's working with neighbors, working with area schools, local businesses, like start where people are naturally or how they're already naturally finding ways to connect and continue building that out. The other piece is finding a focus on relationships and connection. It says in your work, and this is really for people that are serving older adults. So you may have a lot of goals and strategies that you're trying to accomplish, and I can almost guarantee you that a lot of them overlap with relationships and helping people make connections and finding a sense of value. So you don't have to insert a whole, now we're going to do social connectedness type of work into your work. You're already doing it. And so recognizing that and being intentional about how could this program, how could dropping off meals or making connections for groceries also be a meaningful way to help people see that they're a valuable part of our community. It doesn't have to be a whole additional strategy. And again, this is kind of that build it organically and start locally piece of it. And then the last piece around incorporating belonging into your work can also include like finding measurements. So if you have grants to do your work, how are you also measuring the outcomes around social support? Are you asking people how supported they feel and seeing an increase because of the work that you're doing? I believe that you actually would see that increase. I believe that the work that you guys are all doing does foster and build support, but are there specific things that really do it well, and can we increase them? So this is just a reminder of what is social support and social connectedness, and then I did want to give, I think there's a COVID related one on there. Yep. So we are seeing that social connectedness and technology are connected in a very positive way. So before COVID, everyone asked, is technology the reason that all of our social support and our social fabric is falling apart?
Yeah.
And the data actually doesn't point to that. So there are questions about how much screen time do you have, and we cross-tabbed that with social connectedness, and we just didn't see anything of substance connecting that in a negative way. We do see, however, now people that never had the access to or kind of exercise those muscles around their social media, social connections, are really struggling. And that's especially true of older adults. So those that had done some work around, whether it's following your grandkids in another state or you've done a FaceTime, people that have done this and have had access to this technology really fare better right now than those that don't. And if you're looking at people that are in their home and isolated on top of not being connected, how do you even find them? How do you start to identify where they are, who is not connected when they're so disconnected? And that's really, I think, some of the strategy that we need to look at is how do we identify the people that are so detached? These are the people that are extremely lonely. These are the people that really are going to see negative health outcomes because of their loneliness. And how do we start to identify them and connect them back in? And I will say a core piece of that could be faith communities. It could be your neighborhoods. Again, you got to start where people are, and if they're not connected into a lot of other things, how do we find them? So there's a thing called, I'll bump up to Oshkosh Oshkosh Healthy Neighborhoods had gotten a grant through Bader, and they're working with the senior center to help bring technology into the homes of people that are not right now equipped. And so that's one strategy that's out there in our community. I don't have information necessarily on that. I just know it's a program and a project that is happening. We have a warm line that has been established because of COVID. If you just need to talk to someone, or if you know of someone that needs to talk to someone, that phone number is up there. We have a lot of neighborhoods in Oshkosh. We are fantastic at really helping build and support neighborhoods. Not all communities have this. So that's a huge asset that I think could even be explored much more to help do some of that outreach to people that are really disconnected. Because again, everyone lives somewhere. And the other piece is just be the person that is checking in on other people. Like, we all have older adults in our lives. We all have people that we know are either maybe really busy and disconnected or are just disconnected. And to take some time to write a letter, make a phone call, and connect. And again, this is kind of going back to how do we foster a culture in our community that identifies when people are disconnected. Maybe it's the, garbage isn't going out next door and you're wondering what's happening, and maybe someone's sick. Like, just having the culture where people check in and care for each other and are invested in one another is a piece of what we're trying to foster. So this is an overview of where we're at. If there's any questions or thoughts, or if you want to share what you are seeing and hearing in your own work.
Deb, go ahead.
Thank you. Stephanie, this is a great presentation. Thank you for sharing this. And I guess my question would be, currently already we're seeing, an uptick, obviously, by just the surveys you did with the numbers and things escalating and being higher as far as being disconnected or not feeling supported. So my question is I would assume that you're anticipating perhaps even more challenges, because now we're going into a season where, if you notice, like, we're getting less and less light, and then we have those that, may kind of succumb to seasonal depression because there's not as much daylight and the weather starts to get cooler. More people are inside than outside. So is that kind of factored into any of the potential programs in the near future to address the even more feeling of isolation than currently with the pandemic?
I think that's a great question, and I know, I believe Winneconne was looking at a grant to explore how to foster social support during the winter months, and that's certainly a piece that we have to factor in, just given the nature of where we live in a community. So some of the strategies around that are having local community centers, like whether it's a school that's the community center. Obviously COVID right now doesn't allow us to get together, but if we're looking at a long-term strategy, having those like neighborhood-based hubs where people can convene, because maybe you don't have the ability to drive a car, but you can still walk, or someone that's a neighbor could take you to a place. It's how do we get people to come together? And I think that might look different from community to community.
Thank you.
Mm-hmm. I was just wondering, Jean, maybe could you share a little bit about the Tech Connect the Senior Center is into? Are you going to share that later, or? Because I think that would fit with what she was referring to there with the Bader grant, and
Sure.
doing some really good work there.
Yeah, currently we have the individual right here in the room that actually applied for the grant. Ann Schaefer is an employee through the city of Oshkosh. So I don't know if Ann, can you step to the podium and maybe share what we're doing with the Bader Foundation and the grant?
Just quickly, it was a grant that we received last fall on bringing technology to the seniors to help them socially connect. This was pre-COVID, so interestingly enough, it became even more important. So the program's going on right now. You can call the senior center, and you can call us with any technology question you have. We do one-on-one appointments with you and walk you through your issues. We've had 35 people see us so far since August. We have funding through next year to continue to staff this. We see people in a one-on-one environment, so it's safe. We're like 2 people in a room. The questions and things that we've been able to accomplish are amazing. We talk to people that have been in their homes since March and never went out. So we've hooked up those individuals that are in their 80s with iPads and iPhones that allow them to FaceTime with people. We've talked to people that are scared of Facebook. And a woman was in tears when I showed her Facebook and how she could see pictures of all her family. So that's the type of thing we're doing. If you have any questions, just let me know.
And those classes are held at the Oshkosh Senior Center, just so people do know that when they call, they come to the center. And again, in a room that we have sanitized and had gotten ready, social distanced, and again, limited amount of people that are in that space. So.
Go ahead, Deb.
And if I may just ask Ann and Jean, besides that, where there's like actual person-to-person contact in a safe environment, what other things for, say, the seniors is there available that's in a person-to-person type contact but yet safe?
Well, right now, currently, we have our fitness facility available for people, and we do it by appointment only, and it's 5 people per 45-minute time block. And then we clean, sanitize, and then the next group comes in. We have started some small group art type classes, trying to build slowly. We kind of held back a little bit this in the last couple weeks due to the surge of the spike of the virus. But hopefully we can continue to offer small, very small groups, up to about 5 people in a space very similar to what we're doing currently right here. And we've done bingos, we've done book clubs. Actually, we do a lot of virtual things too, so that we can get people to be together virtually as well as in person. But
Yeah, I think that's great. I think it's just more about getting the messaging out there, because I'm hearing from a number of seniors or family members of seniors that are thinking that the senior center is still closed down. So I think we just got to maybe tell our story a little bit better. Same with, even the county. There's great stories to tell. We just need to somehow get it out there a little bit better.
Yeah, and I do want to make sure the neighborhoods are involved with this. They are the boots on the ground, and we work closely together, and their job is to identify those individuals that are home alone that we don't know about.
I just wanted to share that at the YMCA they are offering a coffee clutch, I don't know the correct word, on Fridays from 7 until 10:30 at the 20th Street YMCA, and people bring their coffee cup, and then the Y provides the coffee, and then they're socially distanced, and there's been a good response for that.
So last June, we had a person named Paul Bourne from the Tamarack Institute come to Oshkosh, and he really, in his organization, specialized in a lot of social connectedness. We had over 100 people convene and learn about some of this work around social support. he mentioned, like, you know, a very neighborly thing to do is to take soup when someone's not feeling well. But some of that also requires, like, knowing your neighbor. What kind of soup would they want? Is it chicken soup the situation, or are they vegetarians? So it kind of goes like this hand in hand of, like, we know how to be good neighbors, but also when you've lived next to someone for maybe 5, 7 years and you don't know their name, it gets awkward to be like knocking on the door and saying, I don't know who you are, even though we've lived next to each other. So finding these opportunities to kind of break the ice and start to shift and change our culture. Some of the technology is amazing. We've heard Palaces for the People is a book that's out there that's really great. It talks about holding institutions, public institutions like libraries, as like these critical places where people can come together. Parks, walking through trails, having picnic tables where people can have you know, a picnic or a meal together. Simple things like this about our built environment really helps this like ability for people to come together because they're bumping into each other. Public libraries that have bowling leagues with the Wii for older adults is another like example where maybe like people in Oshkosh bowling team can compete against the Menasha Public Library bowling team. And it's a way for people to come together and still be able to have some social connection and fun, but maybe it's not in a way that they used to do it in the past. So finding just different ways that really work for our community to get people together. I think I'm not the expert here on older adults. You guys are all that. So I think there's just a wide range that we can explore for what can we do for the older adults living in our community, and to have that constantly evolving, because what's, you know, really helpful and cool now may not be the case 10 years from now. So this whole idea of having a culture that evolves with our community is really critical.
Stephanie, can you repeat the name of the book that you were referring to?
It's called Palaces for the People.
Palaces for the People?
Yep. Our library was going to do a book read on it, and there's been some book reads in our community on this. It's a really great, it talks even about how daycares are structured, and usually they're, when you walk into a child care center, it's pretty narrow so the kids can't run away. So you kind of go in, but it doesn't really equip it for like parents to bump into each other and say hi. It's kind of in and out really quick. So like literally how we design our facilities can really do a lot. But it really lifts up a lot of these public places and spaces that people can bump into each other, which are really critical.
I was just going to add, one of the things that I see being used a little bit more is the Next Door Neighbor, it's called the Next Door app. Some of you are involved in that, I know, and it's an app that's, are you familiar with that at all?
Yeah.
Okay. And I see posts on there, reminders, you know, check on your neighbor, things like that, and so people are alert to this to some degree, and I think that second to last bullet point is really good. Be the person to check in with older adults in your life.
Yep.
You know, if we all did that, we're connecting a lot of older adults.
Yep. Professionally, we can do a lot, but also we are people living in our
Right.
community, and that brings, like, what are we doing? And we need to be part of this shift of our culture to not just have programs are great and they're needed, and they really help target to the people that are most needing services, but also we need to be the people in our community that really does take the time to reach out and spend time with each other.
Mm-hmm.
So we're trying to help build both sides of this to be a nurturing and well community.
Are there any questions from our virtual members? Don't want to leave you out. Okay. Well, thank you, Stephanie. Did you want to go right on to some health department updates then?
Yeah, so I was asked to share a couple updates from the health department, especially related to COVID. And the biggest piece is to go to our website. So if you want any updated information, dashboards, where testing sites are, how to find your test results, WinnebagoPublicHealth.org. Visit that site. It will have everything as it changes. That information is like that's gold. So send people to that site. Use the site yourself. The other update that we just wanted to share is at the beginning of September, we saw an uptick in the 18 to 20 something year olds as having a lot of the positive COVID results. that's really leveled out now, and we're seeing it broadly across our community. Obviously, I think many people have heard that we are in a surge. We have a lot of positive test results coming in, but it's really expanding across the whole age demographic. It's not just the college age piece, and that's just a message we really want to get out there: to distance, to wear your mask, and to not think that this is just a college age thing. It's really spreading across our community, and it's impacting all of the ages. The other piece is it's flu season, so remember to get your flu shots and check in with your doctor on that. And that is roughly it. A lot of the services that public health nurses had been doing to serve older adults have been paused while we're doing the response to COVID. So if people are wondering if a public health nurse had come to visit them, why? That is the reason. When things get back to normal, things can change and shift back to services as they were resumed. But right now, all of our public health nurses are very active in response to COVID.
Stephanie, do you have any sense of, the surge you're saying is not necessarily related to the college age crowds and that? In terms of the general community, what are you seeing as terms of the reason for the uptick? Is there people not doing the things they need to be doing? Are we having too many parties, or what's happening that's...
People are getting together with people. It's a lot of so weddings and family events, birthday parties, all of that had been postponed for so long and then rescheduled, and it's people coming together with people. That is the largest, that's the reason that this is happening. So I can't say necessarily, I'm not a contact tracer. Maybe Sue can share a little bit on what's exactly happening, but it's people coming together with people. Of the calls that I have had, it was usually things like birthday parties and weddings and funerals and things of that sort. Normal, family gathering activities that we have.
Where they're not wearing masks and not social distancing and not necessarily washing hands a lot.
And it would be hard to social distance
Sure,
at a lot of these convenings. So we're in a hard time. It's been a long time, but if we really want to get through this, we have to have safe practices. So again, go to our website if you want any updated information, or if you want to look back at some of those dashboards and see how the trends have changed or how they're going to change. Our website has it all.
Okay, thank you so much. This is very helpful.
Thank you.
Appreciate it. Okay. Okay, moving on to old business. November election and voting information. Judy has some information she'd like to share regarding that.
Good morning, everybody.
Good morning.
Strange being on this end of the camera for meeting. We're talking about the 2020 elections, and election day itself is November 3rd, and deadlines for voter registration by mail is Wednesday, October 14th. In person, it can actually be on election day. Online could also be that Wednesday, October 14th. Request a ballot, you go to your city town clerk. Most of us from the city of Oshkosh that had not already applied for absentee ballots, received something in the mail earlier, was returned, and many of us have already received those absentee ballots. They can be deposited in the drop box at City Hall, just to the left of the main door. And I will tell you that it's been very busy there. It can also be dropped off at the city clerk's office, but it can go in the mail. Right now, there's been an extension of, I believe it's 6 days past election day. Those votes can be counted, but there's also a challenge in court. So I would encourage everybody to get them in as soon as possible. Registration, I just talked about that. You have to show proof of your residency, and non-drivers can get a special ID card through the DMV, the talk to absentee ballot. Okay, one of the things that's really important is to make sure that you've signed it, that you've had a witness sign it, and the witness address needs to be on there also. Many of the ballots that have been challenged or are being returned are missing that address part of it, or the extra signature. I believe that the League of Women Voters is offering some of their members to be the neutral individuals that could be witnessing the ballots. And when we talk about, excuse me just a second here. When we talk about voter rights, you have the right to be privately and independently, access to polling places. And one of the things that is a concern this year is people standing outside the polling places and confronting people going in and trying to intimidate them. So that if you see that happening, make sure that you report it. You have the right to an accessible voting machine or paper ballot, and all polling places are required to be accessible. There are some changes in the voting places in the city of Oshkosh. District 4 has moved from Webster Stanley Elementary to the public library. District 15 has moved from the airport, Hilton Garden Inn. That's due to the construction of the airport. District 9 moved from Alberta Kimball Auditorium to Father Carr's place to be the Mother Teresa Center. And hopefully that part goes smoothly. If you want to check on the status of your absentee ballot, you go on myvote.gov.
.wisconsin.gov.
Go ahead.
myvotewisconsin.gov.
Yeah.
Yep.
Great. And I believe we have a screen that goes up. It tracks from when you requested the ballot to when it was approved, to when the ballot was being prepared, when it was in transit, and when your expected delivery. And then it also tells when your ballot has been received by your clerk, or the election group. And so it's a really neat opportunity to tell what's going on. And then with Oshkosh Transit, normally they do a pre-fair day just before school starts. But with the pandemic this year, they have made the decision to support the election by declaring election day a pre-fair day. And riders are able to ride the buses on their regular routes free on Tuesday, November 3rd. And it gives the citizens an opportunity to take advantage, not only to get to the polls, but checking on the safety and security, convenience of public transit, and maybe just visit another place or two in the city that they haven't had opportunity to. So I think those are the highlights that I have on the election. Does anybody have any questions?
Seeing none, I guess. Thank you, Judy. Okay, moving on to other business. Discussion and information pertaining to COVID updates and community resources. We talked a little bit about that already, but Sue Ashton has some information from firsthand contact tracing. Sue, if you'd go ahead, please.
Can you hear me okay?
Yep, thank you.
Okay. I just worked about 3 months at the county health department doing contact tracing, and it was quite the challenge. You do need to have patience And we work from everybody who's like 18 to 90. So, and some people are actually in the hospital when you call. So we were required to call these people like 3 times a day if they didn't answer. Morning, afternoon, and evening. So it takes a lot of your time to even reach one person sometimes. And a lot of younger people would leave their parents' phone number or grandparents' phone number. So it was a lot of problems just trying to get the right phone number. So it was, I guess I would agree that the problem, most problem that we had was ages 20 to 30, the young people. And a lot of them, when you talk to them, as far as contacts go, they had been to several bars, like in Oshkosh, maybe 5 bars with friends. So that's very hard to figure out where they picked up the coronavirus.
Mm-hmm.
The other thing is, sometimes when we would make these calls, young people would never answer their phone, even if you attempted 3 times a day. So then we would try texting them, and they immediately answered their phone. So that was very helpful. And then we had to make a list of their contacts, which took quite a while. And now to save time, some of the counties are actually telling the person who was positive to call their contacts. And that saves a lot of time and a lot of steps for the interviewer. So I guess my message to all of you would be still wear a mask, do the physical distancing 6 feet apart, and I would not go into a restaurant. I don't care if you know everybody in there or you are 6 feet apart within a restaurant. From the callings and things that I did that included restaurants, it's just really not safe to go into a restaurant at this point. If you want to pick up food, that's fine, but to go into a restaurant, I would say that's high on the do not do list. And like the speaker was saying, a lot of people just pick this up from going to birthday parties and funerals and weddings. So that's huge. I guess you have to consider your health as far as that goes, and it's just not a good thing to get together right now. It's just the coronavirus is out there, and I don't know when it's going to get better. It's really bad in our county right now. So that's my experience. Anybody got any questions?
Sue, I'd heard that there's some cutback in the amount of tracing in some places because it's so rampant they can't possibly keep up. Did you experience any of that, or is that true in this county that you were aware of?
You know, yeah, I'm really having trouble hearing
Oh.
the speakers on this WebEx, or I just think I'm going to have to attend the meeting next time because still, it's like when you're talking to me, I can't understand every other word you're saying. So I don't know if it's my computer, or just me or what, but I don't even know really what you just asked me. But as far as distancing, I think you were saying something like, is the distance changed? Is that what you asked?
Well, whether contact tracing has been given up on in some places because it's just so overwhelming they can't possibly do it, so they're not working at it anymore. At least that's been in the news. Is that something that's true here that you are aware of?
Yes, I have heard that as well. It is very overwhelming, and at some point in time, you have to figure out, you know, what is best for all the people that are trying to do this, and that's why I say that some counties now are just having the person who's positive call all their contacts.
Mm-hmm.
In the past, we as public health nurses would be calling all their contacts, but they've run out of time.
Sure.
And it's just so overwhelming, they can't do it.
Mm-hmm. Okay.
So I have a question regarding the,
It does take a lot of patience. It does take a lot of cooperation with the person you're working for, because some people that you call are really not not cooperative, and they really, so that makes it very frustrating.
Sure.
And you have to have a personality where you can, you know, actually talk with young people without getting upset with people of why they did certain things.
Right, yeah.
It takes a bit of finesse to be a contact tracer.
Yeah, Sue, Jean has a question for you as well.
Yeah, I just have a question regarding the testing site. I know that they just announced yesterday or a couple days ago that the testing site is taking a couple hours, that people are waiting in line.
3 to 4 hours. I drove by there yesterday, and the cars were not moving, the lines were very, very long, and it's taking, they said the best thing to do is to register, because that's holding people up, but yes, be very patient, because it takes 3 to 4 hours as of yesterday.
So are they possibly talking about opening up another site?
I don't know, because I'm not working there anymore. I did that temporarily from about March to June, end of June. So I don't know what they're considering. I really don't. I guess you could call them and find out.
Okay, thank you.
Okay. Sue, some thoughts on flu shots as well, please.
Okay, yeah, very important, as the speaker noted, to get your flu shot. And I got mine, I think, last Friday, and the pharmacist said, we're going to be out of the high dose starting tomorrow, which would have been this last Saturday. And he said it'll take a week or two to get it back in. They have plenty of doses for, you know, the regular population, but for older adults, who need the high dose, they were going to be out of it as of the next day after I got my shot on Friday. So that in one way that's good, saying people are getting their flu shots, but in another way that's a little sad, because it's out there to go get them, and then if people try to get them and they don't have the vaccine, you know, that's a problem.
Right. Especially
So
since,
that's really important to get that, because that will protect you, at least, you know, from the flu, because if you got flu and COVID together, would be a disaster.
Sue, should people be checking with their medical facility or doctor's office? Because this may be isolated, perhaps in your situation with the pharmacy that was out or going to be out?
Well, I suppose you could call your doctor, but for the last couple of years, it's mostly the pharmacies that are administering the flu shot. I don't know that healthcare providers offer that. I haven't talked to them or called them, but for the most part, people are just getting it at the local pharmacies.
Okay. I know Aurora, at least in our case, we have appointments coming up for our shots on the 14th. So, and that's through our physician's office. So apparently there's pharmacies doing it, as well as checking maybe with your doctor's office, or maybe they'd be running a clinic as well. So it's worth checking around, I guess, because we are being encouraged to have them early this year, get them early from what I've been hearing. So hopefully we're not running out of the high dosage for the seniors this quickly. But thanks for bringing that up as an issue. People should be checking it out. Anything else, Sue? Anything else you want to share with us?
No, that's
Okay.
Those are the highlights.
Okay.
Thank you.
Thank you, Thank you, Sue. Judy, you've got some information on the testing sites, and I think we have a screenshot there as well.
Okay, the testing sites out at Sunnyview, and Sue's correct as far as the backup. Last week, I was out there and was able to get through in less than 2 hours. And so it's really very well organized. It's definitely a serpentine line going through. And then when you get to a certain point, there's a small sign that you gotta watch. If you've got 2 or more people needing to be tested, you cut ahead of a ton of cars. There's a separate line for that as you get further along. The test itself is not that bad, but there were new hours that were started back on September 30th. They're closed on Sunday, but they do have longer hours during the week. Saturday is 8 until 4, where during the rest of the week it's 10 until 6. And pre-registering is definitely a very good idea. One of the other things that I have, and Ray, I'd like you to step in if you would please, the Farmers to Families food box distribution. Part of the current poster out there has a little bit of misinformation. So would you give the correct information, please?
I'm not sure what information is incorrect, Judy, so can you?
Part of it talks about Green Lake. Part of it is correct with the Menominee Park near it, but then it talks about the Green Lake drive-through distribution. So if you could give the specific, the dates are the 12th, the 19th, and the 26th, 10 until 11:30. And then if you could give the directions as far as going through the park, please.
Sure. And the information comes out from other resources. We don't put this together. We help share it because they utilize the park, so I can make sure that they get that updated for you. But essentially, as Judy said, the Farmers to Families food box, the program will continue into October. It's Mondays, October 12th, 19th, and 26th from 10 to 11:30 at Menominee Park. And if you're interested, you should enter the park off of Merritt Avenue, which is essentially the main entrance just south of the zoo. And as you get into the park, you're going to stay to the left and follow that roadway along the tennis courts and that area up until the Millers Bay parking lot area. That's where the semi-trailers with the food are available, and they'll have volunteers that load the food boxes into your vehicle.
Okay, thank you.
Sure.
Okay.
And the food boxes are very good. It's not just low income. There is no income requirements for it. There's 10 pounds of pre-cooked chicken strips, potatoes, carrots, yogurt, milk, things that a lot of families need. And one of the things I heard is, sorry, I hit a wrong button.
Yep. Okay.
You can't do a lot with the chicken, but what I'm also hearing is people are using it with a hamburger helper. They're not only doing chicken salads and chicken casseroles, they come up with some really creative things. So it's a good chance to do some experimenting. And then this isn't necessarily something that we're talking about for every day, but if people have not already gotten their real ID, which is necessary for flying or for governmental buildings, the deadline for that was this month, and that's been pushed back for an entire year. So that's something to take into account also. Any questions from anyone? Thank you.
No. And Judy, you got a little something on the Real ID update? Oh, she did.
Yeah.
Okay, I'm sorry. I'm sorry, I'm behind the, okay.
What was that,
Thank you. My mistake. Moving on to other business, FB, discussion and information pertaining to scams targeting senior citizens. Judy, did you have anything you wanted to add there regarding scam?
Are you talking to me?
Yes.
Okay. One of the big ones that's been going on recently, and my 90-year-old lady that I provide a lot of assistance to, who's definitely one of the victims of it, is the Apple scam. And they're very persistent. And the Consumer Protection Office was talking about it also. And people are getting these calls telling them that there's problems with their Apple account, all these different things. Press 1 to connect to the support advisor, press 2 to listen to the message again. And if they press one of those numbers, it just increases the number of calls in a short period of time. And my Jeannie received, and I checked her caller ID. She got more than 24 calls in less than 24 hours. So not overnight, but she was getting them. We've been working on not answering unless she actually recognizes the number when it's called out to her. She's legally blind. But they would, the phone would ring and get the answering machine. It would just ring, and when I was going through her caller ID, each of those calls to her was a different phone number, same area code, but two who had the same prefixes. So they're persistent and they're nasty. Miss Julie Davids was on. There's a new scam on the memory training services. There's billings for all sorts of memory training and or being billed for training services when they're serving someone with severe form of dementia, and probably past the point of being able to actually utilize the services. So those are my big ones. Ron, I think you've got lots more.
Well, I have just one more in the interest of
Hey,
time.
Judy, I'm here.
Yeah. Julie is here to add to that if you'd like
Well,
to.
no, I'm just here.
Oh, okay. Yeah, she's here in person. Okay, we have received a fraud alert from Wisconsin Senior Medicare or Medical Patrol, and it has to do with the open enrollment for the insurances, Medicare insurance programs this fall. And every year there's this 7-week period from October 15th to December 7th for open enrollment. And I was just talking with Bryn Seaman from the ADRC before the meeting, and they're very, very busy as they're rolling up to this time. You can go online now at medicare.gov and see plans. You can't enroll yet, but you can see them. And one of the things that they're anticipating with the COVID pandemic going on, that there'll be some fraudulent attempts to take advantage of people, increased telemarketing calls, for example, and the potential for increased marketing solicitation in medical offices. And they're looking at a third one, activities tailored to shift from personal meetings to electronic platforms like Facebook, Instagram, customized ads, and so forth. So they're saying some of the examples to be careful of would be enrolling a beneficiary into a plan without their permission, using incentives to convince a person to sign up for a specific plan, for example, offering free trips, meals, or other benefits for signing up, misrepresenting the plan's benefits. In other words, lied to about providers and or specialists in the network, or claiming persons will save money on the prescription costs with the plan that they're pushing, using scare tactics like sign up now or you'll lose your Medicare benefits, or attempts to sell a life insurance policy or an annuity at the same time they're discussing a Medicare plan. Those are things that are definitely not allowed, and just a few of the regulations set by CMS, and CMS is for the Centers for Medicare and Medicaid Services. These are rules that are established by CMS for those who are marketing the Medicare Advantage plans. One is they're not allowed to market 2021 plans prior to October 1st. The insurance company and agents are not to imply they are associated with Medicare or CMS. They're not allowed to market or host sales activities in residential settings outside of the recreational or conference rooms, nor are they allowed to solicit door-to-door. Agents are not allowed to send unsolicited text messages or voicemail messages. They're not allowed to promote just one aspect of an overall plan, such as the drug plan. Agents are not allowed to ask for credit card numbers, banking information, your Medicare or Social Security number in order for you to receive information. They're not allowed to use high pressure sales tactics and or incorrect information. They're not allowed to threaten that your Medicare will end if you don't enroll. I mentioned that earlier. And they're not allowed to say that you must enroll by a certain date or you lose the opportunity to enroll. And if you run into issues with some of these practices, you're encouraged to report your concerns to the Wisconsin Senior Medical Patrol, and the phone number for that is 888-818-2611. 888-818-2611 to report that so they can stop those activities. Okay. Questions on that at all? This is the busy time coming up now for seniors signing up. One point to make, I guess, is that they recommend that you every year check the plan that you have and make sure it's still the best one for you by going to Medicare.gov and comparing the coverage you have going forward with the plans that are available. Don't assume that your plan, just because it rolls over, is the best one for you. Okay. Okay. Moving on to discussion and information pertaining to strategic plan. The first is strengthening our partnership with neighborhood associations and other partners. Julie Kiefer and Julie Maslowski.
Julie Keeper had to leave for another meeting.
Okay. Okay. So, Julie Maslowski, would you have some commentary for us there?
Sorry, repeat that wrong. It's really hard to understand you.
Okay. Would you have any update for the strengthening our partnerships with neighborhood associations and other partners?
Not at this time, no.
Okay, thank you. And moving to improve access to affordable transportation and delivery services for seniors, Judy?
Well, there's been lots of progress made as far as the delivery services. The grocery stores and a lot of the other stores have really stepped up with having curbside pickup, actually the shopping for you. Walmart, Pick and Save, Festival, all do it. Aldi's was even stepping in to do a certain amount of it and then just pick it up. And when we when Sue was talking about the flu shots, some of the pharmacies, like Hometown, will actually come out and do your flu shot with you sitting in your car. So a lot of the businesses are really stepping up to make things more convenient, definitely very safe for us. Transportation, there's a couple of programs that I'm trying to explore a little bit further. We'll have more information on that at some future date.
Okay, thank you. And create community design and policy that supports an age-friendly community. Jean, would you have some thoughts there?
Yeah, Bryn is still back there. We've been working on something, and we will put together a presentation and possibly in the next couple of meetings. Unless if Bryn, do you have anything to add?
I
just share that with Jean's help and others in the community, we have applied for the age-friendly community membership with AARP, and hopefully in the next week or two, we have a meeting with our state representative to review that plan. It includes a lot of the good work that was already mentioned today, and as Jean said, we'll present more as we know more.
Okay.
Thanks.
Great. Thank you. And then the last work group we have is improve communication and visibility of available services to seniors. And Judy, if you'd take the first section there, please.
Ron, I'd suggest.
Should we just hold on that for a future meeting?
Put this off till next month because it's a fairly lengthy report. And
Okay.
we're sort of to the end of how much time is allotted for our meeting.
Okay. All right. Could we maybe just have a quick silver linings, good that is happening in the community during the pandemic? We should maybe end on a real positive note here. Heidi, any thoughts there?
Can you repeat the question, please? I'm having a hard time hearing.
Yeah, I'm just wondering if you'd share some of your thoughts regarding the silver linings.
If I understand correctly, I think you asked me if there's anything I wish to share.
Yeah.
I put my hand up during when you're talking about frauds and that wasn't recognized. I wanted to mention, I want to go back to that for a second, if I may. I get about 5 to 10 phone calls a day on my business line for some pre-recorded Medicare or a Social Security specialist who wants to help me with my Social Security or Medicare, whatever it is. And boy, they sound, if you haven't received any of it, I mean, the first time you hear it, it sounds pretty darn convincing that it's actually a person. People say, "Hi, my name is Julie, and I'm with the Social Security Administration. I'm a Social Security Administration specialist, and can you hear me?" It's very tricky on the things that they want you to say. So, I would just encourage people that if you don't know the phone number, and I know this was mentioned before, don't answer it. I've had some older friends of mine that have been taken advantage of recently, and they're very tricky, they're very creative, and they're very good at what they do. And so this might make it more difficult for the people who are doing the contact tracing, because people won't answer their phones if they don't know who it's from. However, boy, you really have to watch yourself in regards to that. In addition, that I would like to add is that, elder abuse is still going strong in the community, unfortunately. And as I spend more and more time working with older adults and people with disabilities, my head just explodes at the fraud I see on a daily basis. If you suspect, anybody that you know or love, or somebody in your neighborhood that is being abused, and I see a lot of family members taking abusing financially more than anything else, that if you suspect something's going on, please contact Winnebago County and Adult Protective Services and just say, hey, I have a concern. Or if somebody is living independently in their home and you're thinking, gosh, I'm concerned about their safety and well-being, have somebody check it out. It's better to be safe than to have somebody continually being taken advantage of or at risk of being unsafe in their homes.
Okay. Thanks, Heidi. Good information. Julie, did you have any thoughts on the silver linings
Sure.
section?
So a silver lining for me personally, and I'm sure it can reach out to everyone, is I discovered all the beautiful parks in Wisconsin. So my family and I, instead of going to restaurants like we normally do, we visit different parks. The park we went to this weekend was in Marinette County, and there's 15 waterfalls. They're absolutely beautiful. And the sound of the water, and it's a safe place to spend time with your loved ones.
Mm-hmm. Great. Thank you. As well as those parks here in Oshkosh, right, Ray?
That's correct.
Yes, those two.
All right. Thank you. Want to just announce that at our next meeting, November 3rd, we have a speaker, Jennifer Skolaski, dealing with the Falls Prevention Survey that was done last fall and kind of got derailed by COVID, like a lot of other things. We'll be doing the follow-up discussion and progress regarding that. So be tuning in for that. And with that, is there any other items anyone needs to bring up? Otherwise, a motion for adjournment would be in order.
So moved.
Second?
Second.
All in favor?
Aye.
We are adjourned.